Hello, I'm Dr. Anthony Wheeler, and I'm going to tell you everything that you need to know about pathology. Look at this nice lady providing expert level medical care. What's she doing? Checking this patient's blood pressure with a smile like you, glowing, beaming. Today we're going to be talking about hypertension. This is covered in depth as far as you need to know for a medical school pathology or step 1. You already have this book. That's why I'm proud of you. Keep learning, keep growing, and let's continue forward. Hypertension. What is it? Hypertension is a blood pressure of 140/90 millimeters per mercury or greater, and that's what indicates a high blood pressure, aka hypertension. Hypertension can involve the pulmonary circulation, with the lungs, or the systemic circulation going out throughout the rest of the body, or it can involve both. Pulmonary hypertension refers to hypertension in the arteries that deliver blood from the heart to the lungs. Systemic hypertension refers to hypertension in the arteries that deliver blood from the heart to the tissues of your body, except the lungs. In general, a normal blood pressure is 120/80 in regards to hypertension, or a bit lower. For example, I should tell you the range, right? 120/80 for mnemonics purposes. It's easy to remember that value. But if you want to know the range, think of a normal blood pressure as 90/60 millimeters per mercury and 120/80 millimeters per mercury, somewhere in between there. Now, based on the etiology, hypertension can be classified as primary or secondary. An unusually high blood pressure, like the blood pressure I get when I'm standing in front of a lecture and no one's listening to me, an unusually high blood pressure that is not brought on by a medical disease is referred to as primary hypertension. 95% of cases of hypertension are due to unknown causes, and this is primary hypertension. There are risk factors for primary hypertension. Do you know any of them? Age, perhaps. Obesity is a risk factor. Stress, lack of exercise, too many chips, a high salt diet. That's my weakness. Or even race can be a risk factor for primary hypertension. African Americans or Americans of African descent are at increased risk, followed by Caucasians, then Asians. Here's a little diagram indicating the different types of hypertension, whether it's primary or secondary, the potential etiologies, and how that impacts risks of certain conditions like a stroke. And we absolutely need improved treatments. Let's talk about secondary hypertension. What brings on secondary hypertension? What is that exactly? Secondary hypertension is high blood pressure brought on by a specific illness or disorder. We can see that in this image with this beaded aneurysmal appearance of the distal renal artery. Do you know what causes that? We're going to talk about it a bit more. In regards to secondary hypertension, 5% of cases of hypertension are due to known causes like FMD. Do you know what that stands for? We're going to talk about it. Renovascular hypertension, also known as renal artery stenosis, is a prevalent cause of secondary hypertension. In renovascular stenosis, stenotic vessels decrease the blood flow to the glomeruli. In response, the juxtaglomerular apparatus, you remember that from physiology, the JGA, well, that secretes renin, right? And we all know what renin does. Renin secretion causes angiotensinogen to be converted to angiotensin. Angiotensin converting enzyme transform angiotensin 1 into angiotensin 2. Angiotensin causes the smooth muscle in the arteries to contract, which the total peripheral resistance, and in turn, the blood pressure. So the total peripheral resistance increases when that contraction occurs, and that causes the blood pressure to increase. Additionally, it stimulates the secretion of aldosterone from the adrenal glands, which boosts sodium absorption in the distal convoluted tubules and raises the plasma volume. Renal vascular hypertension typically causes unilateral renal atrophy, one side, left or right, and this is due to inadequate blood supply. And hypertension with elevated plasma renin levels also result. Causes of renovascular stenosis include atherosclerosis, as well as fibromuscular dysplasia, FMD. I told you we were going to talk about it. Atherosclerosis typically affects older men. Fibromuscular dysplasia characteristically affects younger women. FMD is a developmental defect in the blood vessel wall that causes an irregularly thickened renal artery, more likely to affect young females. Let's talk a bit about benign hypertension. We know that hypertension can be categorized as benign or malignant. A mild to moderate increase in blood pressure is referred to as benign hypertension. Most hypertension cases are benign. And clinically speaking, benign hypertension tends to be silent, causing organs and arteries to fail gradually over time, just like people studying for step 1 without this material. Tisk, tisk, sucks to be them. Anyhow, you're ahead of the game. Speaking of which, here's just a little representation of someone with benign hypertension. Got the blood pressure cuff there, doing a thorough examination. On the flip side, malignant hypertension is characterized by a blood pressure that is greater than 200 over 120 millimeters mercury. Less than 5% of cases of hypertension involve malignant hypertension. Malignant hypertension may arise de novo or from pre-existing benign hypertension. Malignant hypertension is a medical emergency. Call the ambulance. Stat. Malignant hypertension can cause severe end organ damage, such as acute renal failure, papilledema, stroke, and hemorrhage. Woo! It's a medical emergency. This is an example of a patient that had malignant hypertension affecting this particular organ. Can you recognize what this histologic section is from? You know where a glomeruli is from. That's right, kidneys. Woo! Excellent, excellent. That's a very important lecture that you just completed. You are definitely on track. You're going to do so great. You know so much. I'm proud of you. Keep up the good work, and I'll see you next time.